Hi, it's Patrick Hutzel from intensivecareathome.com.au, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomy by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I talked about ventilation and tracheostomy. How long is the intensive care stay? You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to talk about: are intensive care units operating in a vacuum when it comes to end-of-life situations? Last year I attended a presentation at the ANZIC's Intensive Care Conference in Melbourne, where one of the presenters was talking about a study they had done in their intensive care unit about how families experience death of their loved one in intensive care. The outcomes of the study weren't overly surprising, and it very much came down that families wanted to have good communication, get them involved in the process, have dignity, respect and privacy at the end of the life of their loved one. They also wanted to have their cultural, religious and spiritual needs met. And there was another issue that was highlighted that stood out to me, where a solution to the problem hadn't been provided. Families wanted to have their loved one dying at home and not in intensive care. This very much goes hand in hand with other studies and surveys that have been done in the recent past. For example, Palliative Care Australia issued a study last year that 75% of Australians wanted to die at home, and yet less than 20% actually do die at home. You can also check out a related article below this video, where Palliative Care Australia is calling for better end-of-life care services. So, where do people die if they're not dying at home? Well, I'm sure you guessed it. They die in hospitals, nursing homes, hospices and intensive care units. Going back to the presentation that I attended to last year at the Intensive Care Conference, I asked the presenter how he would want to solve the issue of families wanting their loved ones to die at home instead of intensive care. The response I got was that it would be too difficult to take intensive care patients at the end of their lives home, and that it would be almost quote-unquote impossible to do that. I then asked, so are you saying that intensive care units operate in a vacuum and don't give people what they want? I also provided a solution to the problem by offering intensive care at home services, and also pointed towards this solution being available in other countries for nearly 2 decades now. I strongly believe in giving people choice and giving them what they want, especially in end-of-life and death situations, especially if the situation is manageable and foreseeable. Having seen many poorly handled end-of-life situations in intensive care, where people felt bitter and disappointed, have always left me feeling that there is a better way. Getting patients and families involved at the end of their lives and giving them choice is not optional. It should be a given in a first world country like Australia. If more than 2/3 of the population wants to die at home, we need to stop making excuses why we can't give people what they want. What are your thoughts? Do you think that intensive care units operate in a vacuum when it comes to end-of-life and death situations? Do you think that intensive care patients should have the option to die at home if they wish to? Leave your comments on the blog. Please also note that Intensive Care at Home has been selected as a preferred provider for Queensland Health Services as part of the recent Hospital in the Home tender. We are also currently hiring experienced critical care nurses with a critical care certificate for a ventilated Melbourne client close to the CBD. For more information, check out our career section. You can also contact me if you want to know more about how we can help you, your intensive care unit and your patients or your families. Thank you for tuning into this week's blog. This is Patrick Hutzel from intensivecareathome.com.au, and I'll see you again in another update next week.